Okay, in today's video, we're going to go over the client consultation form. So this is what you're going to find in your portfolio. So the first two parts of this, all you're actually going to do is you're going to hand these to the client and they're going to fill out all of their personal information. So you'll notice this first bit, you've got your client details and you've got your emergency contact. You've then got your client lifestyle and then they've got to put their GP details in. All you're doing in your assessment is you hand these to your client. They're then going to fill it out. You just need to make sure that every box has something in it. So make sure they don't leave any kind of emergency contacts blank or the GP's details. So, and same in a real world scenario with a client, make sure you've got all of that information. The client is then going to fill out all of their medical history. They're going to sign and date it. And then you're going to sign underneath just to say that you was a witness on the day that they were there when this was actually filled in. This is the pages that kind of matter now. So this is what your consultation is going to be, your assessment is going to be based on. So what you'll notice here is we've got the reason for visit, subjective history, we've then got objective findings, and then we have to do a functional test with them. So I'm going to kind of go through these now, and we're just going to base it on an example. So reason for visit, this just needs to be really brief. So we're going to say that they've come in with tight upper back. So it doesn't need to be very detailed. It's just what is the reason they've walked through the door today. Subjective history, this is now where you get the opportunity to ask as many questions as possible to find out about this problem that they've come in with. So we could start with something like, is there any previous history of injuries? Another one you can use is your typical kind of what, when, why, how, and where. So put these in. Excuse the non-capitals for now. So you're asking, what happened, if anything did happen, when did it happen, what was the situation behind it, how, whereabouts. You can even throw in a bit of lifestyle information here as well. So as an example, what do you do for a job? Could it be that they're working in an office all day sitting down and actually it's the slouching at the computer that could be causing the problem? So this is, like I say, this is your opportunity to ask anything now to do with the reason they've come in, to try and find out more about it. Like, was there a cause? Once you've done that, on these little images over to the right, you're just going to circle the area where they're saying the problem is coming from. So now we get on to objective findings. Where it says joint, all we're going to do here is put in the closest joint to the area that we plan on working. So we've said tight upper back, so we're just going to throw in, let's just say thoracic, part of the spine, and also the shoulder joint, because they're going to be the two main areas we're probably going to be looking at working around. And then under soft tissues, listing the muscles that you plan on looking at. So we're going to say traps, deltoids. If they're slouching, potentially we'll throw in chest as well. What happens now is this is now where you're going to get the client to stand up, and you're now going to go through a series of different tests with them. So posture, we're going to assess, is their posture good, but we're also looking for differences in asymmetry. So are the shoulder levels slightly off? Are the hips a little bit out of a line? So let's just say that there's slight kyphosis here. So the client tends to slouch. If everything's okay, if you don't see any problems, you can literally just type okay. If you notice there was, I don't know, say one shoulder higher than the other, you could literally just type shoulder higher right. Just so you're saying that the right hand side is a little bit higher. When it comes to movement now, you're going to ask the client to go through a series of different movements. So we might do shoulder elevation and depression. We might do protraction and retraction with them to basically test that the movement. Is one side more restricted than the other? Do they both go smoothly together? We're just looking for things that could potentially go wrong. But again, if everything's okay, you can just put okay in all of those boxes. And the final part now is the palpation. So this is your opportunity now to feel around the area. So what we're looking for is tightness. Is there pain in the area? Is the range of movement limited? So if there's tightness, you can just write where the tightness was. So traps tight left side. Pain was a shooting pain on the right hand side. Range of movement limited on left shoulder. So you can put all of that information in that box, but again, if everything's fine, just write okay. The reason we have two more of the same box now is if you're looking at working multiple different body parts. If they've come in with a leg problem and also maybe a shoulder problem, you've then got more space for it. But the one thing to make a note of, if you don't need these boxes, always cross them out. So put a line through the whole thing. That way nobody can come at a later date and add extra stuff to your form. So you're basically saying, no, this was the end of the testing. Nothing else happened from this point. So cross everything out. ADL functional test. So these bottom boxes now, ADL stands for activity of daily living. So effectively we're asking them to perform a test of something they do on a daily basis to try and replicate the pain or the problem that they've come in for, so we can see it firsthand. So if they've come in and it is, let's just say shoulder pain, they may have, or they may struggle, sorry, to reach something off a shelf. So we're just going to put in here, grab item from high shelf. So this is the test I've got the client to perform because I'm trying to replicate that problem. And then the findings is what happened during that test. So you could say pain once shoulder, went overhead. Client mentioned shooting pain. So you're just literally putting all of this information in there to like I say, put what it is that you found from this test. Now what's going to happen, now you've done your testing with the client, you're going to come down to this final part. So clinical findings, structures and findings as well. This is now you basically writing down everything that you think is the problem now based on what you found out from the testing itself. So you could put that you believe it's caused by constant sitting at work, client slouches, anything that you think is the problem, but try and be as detailed as possible. So if I was to just kind of talk you through one, I could literally say that I believe the problem is caused because the client is sitting for long periods of time at work. This is causing them to slouch, and therefore the shoulders are naturally in a protracted position, meaning the chest has also become tight. Then what we're going to plan on doing is working through the chest, working through the tension in the upper back, and also looking at improving that range of movement through the shoulder. So you would just literally jot this all down in this first column. In this second column now, where it says proposed action, so under the therapist, all you're going to do is list the techniques that you plan on doing in that session. And you can abbreviate these. So you can put EFF for petrissage, FRAGE, PET for petrissage. If you want to do any simple knee and frictions, you just put that. Same for deployment, compressions. So you're just listing the techniques that you want to do in that session. Under client, and this is probably one of the most important columns now. So this is basically any advice you've given the client. It could be stretches that you've recommended for them to do. It could be, so as a perfect example here is, let's say you've got a female client, you need to work the upper back. If you need to basically work the whole upper back, but obviously the client is wearing either like a sports bra or a normal bra, this is where you're going to mention in this area, saying things like, have advised the client that they may need to unclip their bra. So you're checking for comfort levels of the client, but also mentioning anything that's going to cover you as well. So anything you feel is relevant to mention to the client before you go ahead and do that session, jot down in this column there. And then to finish off the consultation forms, you read this all back to the client. So you literally explain everything that you've just worked out. So what you think the problem is. You then tell the client what the techniques are that you're going to use. You're then going to go over anything that you've put in this client column. So another one as well to mention in here is discomfort. So mention to the client, some of these techniques may be uncomfortable. So what we're going to do is use a 1 to 10 pain scale. So let them know how the session itself is going to run. And then once you're happy, the client signs and dates, you then sign and date it, and you can now get on with your actual maintenance massage with that client. So hopefully this helps out a little bit in explaining how the actual forms themselves work. But if you've got any further questions, feel free just to let us know, and we can always jump on a call or drop some comments below and we'll answer everything there for you. Thank you.